One of Dunedin Hospital's top doctors says it's unthinkable the Southern DHB is paying surgeons to not operate. Now, the acting head of the emergency department, Dr. John Chambers, says a lack of ICU beds at the hospital means surgeons are sometimes being paid to do nothing because patients can't get post-operative care, so the operative doesn't happen. It comes after the chairman of the Urological Society of New Zealand described to us earlier in the program a crisis of patient care at the hospital, with prostate cancer patients waiting sometimes for months for surgery. But Dr. Chambers says the problems are widespread. He says patients are regularly queuing at his emergency department to be seen, with some waiting more than 24 hours before there's a bed in a ward.
Even to get into the department, sitting on stretchers at the door, which is very stressful for them and for the staff looking after them. And then at the other end, the hospital is completely full some days, most days at the moment, and people have to park literally in the emergency department for even up to 24 hours before they can find a bed in the hospital. And that's the whole system sort of backing up.
Are you underfunded? Do you have enough money? Is the Ministry of Health giving you the money and resources you need to do the job you want to do and are there to do?
I think we are underfunded. Not just the Eden Hospital, but the whole health system is lacking in funding, and that's showing up in our performance, I think, and also in what has to preoccupy the minds of our managers and our boards. They spend all of their time trying to adjust and fix the books, instead of actually concentrating on quality of service to patients.
Is there a very real sense that there is pressure on to get the books right?
Absolutely. It's absolute pressure to get the books right. Depressing pressure, constant. As you know, the ministry are always sending these depressing messages to DHBs that they've got to get their act together. And that's all about the finances.
So therefore, does your CEO find himself between a rock and a hard place? On the one hand, he has physicians saying, hey, we want to do the work, and the queues are very, very long, and the stress and pressure is becoming immense. On the other hand, he has a commissioner appointed. He has the ministry saying, we're looking at your deficit. How does the CEO get the balancing act right?
I really wouldn't begin to know what to advise the CEO to do, John. I think he's got to do the best he can with the money that he's given, and obviously the CEO and the board and the commissioners have to ask the ministry for more money to help us get the work done. But also the ministry have to take common sense and realise there is a problem. I think one of the first steps to solving a problem is admitting that there is a problem. And there's no doubt that our health boards are struggling because of a lack of funding to meet the needs of our patients.
What's morale like? Because people want to do the work, right? You are there to make a difference, and we keep hearing of postponements, cancellations, and a real sense of frustration. Am I overstating the case in terms of the response of doctors and nurses working in the hospital?
Well, I think our nursing staff, for example, in the emergency department, their morale is high. They're tired, they're exhausted, and at times very stressed, but the morale is high because they're doing a good job. They're trying to do the best for people, and every day they make a difference to patients' lives. So our morale of our team is quite high in the emergency department, I'm sure in other parts of the hospital. But for people like surgeons, for example, it must be very frustrating. I know it's very frustrating for a surgeon to literally be paid not to operate, to have a patient requiring surgery, and they're literally told the theatre are ready, the surgeons are ready, and you can't operate because there's no ICU bed. And they literally have to do nothing. I mean, that's just unthinkable, isn't it, that a surgeon's being paid not to operate when there's demand for his skills or her skills. So I know the surgeons are very frustrated about these cancellations.
It's Dr. John Chambers, who is the clinical leader of the emergency department at Dunedin Hospital.